Hi there, and welcome back to the Uterine Nurse. I'm Michelle, an OBGYN nurse practitioner. Today I'm going to talk about the top 5 reasons you should become a nurse practitioner. When I was thinking of going back to school, these were the types of videos that I was really looking for, and I hope to be a resource for aspiring nurse practitioners to kind of be able to find information, as well as for those who are already nurse practitioners just looking for ways to kind of spice up and make their career more of what they want and desire. So let's just jump right into it. So reason number 1, my big reason for going back to school to be a nurse practitioner was autonomy. Huge. I'd been a nurse for almost a decade when I decided to go back, and that was a huge reason. I love the work I did. I was a labor and delivery nurse for years, and I kind of moved up as far as I could in that area. And the only other logical step for me after where I had been, because I had done charge nursing, we ran an OR on my unit. So, you know, I helped out with scrub tech responsibilities in surgery, did circulating, we had a PACU, we did triage, so like ER. So my point is, I had done a lot, and I realized I wanted more time with my patients, more long-term. And I also wanted to be able to make more decisions about the care and the things that were going on with my patients. So autonomy is huge. If you're someone that really likes to do things on their own terms, on their own accord, you don't really want to have to check in with people, you trust yourself, you are, you know, proactive in learning about the latest and the greatest, you're not afraid to reach out for help, those make great qualities for a provider. Someone that doesn't feel like they know it all, but someone that is very confident also in their abilities to serve and take care of other people. And so autonomy was huge for me. I was the type that anytime I trained for something, I kind of was like, just show me and then let me do it. I really didn't want a lot of hand holding. And as a nurse practitioner, you're not gonna get a lot of hand holding. So if autonomy is something that you really want to be able to make those decisions for your patients, that is a huge reason. And that was probably my number 1 reason. Number 2, I kind of touched on it, having the longevity, you know, seeing patients in the hospital for a short period of time was starting to not become that satisfying. Sure, it's nice to show up and you're there for your shift and then you leave. But there are some times, especially if you're in a specialty that you really enjoy, you want to see your patients more. And when you're working as a nurse practitioner, you get to do that, especially in primary care, which is the setting that I work primarily. And that may be different if you're doing acute care or ER, or those types of things. You might lean more towards the autonomy aspect of it, but hey, there's options. There's so many options in being a nurse practitioner. So the longevity of it for me, wanting to focus more on primary care, staying in my specialty of women's health, I get to see my patients long term. I see them from teenagers up until they're postmenopausal. It's a huge range. And then I also still get to co-manage with my other providers with OB care. I get to see patients for OB visits and OB care, which is just wonderful. It's all across the spectrum. So that would be number 2, would be longevity. Number 3, flexibility. In the profession of being a nurse practitioner, there is a lot of flexibility in this profession. There's a lot of roles and opportunities that you have, and you might know 1 or 2 nurse practitioners and their jobs aren't exactly the same. The patient populations they serve in aren't exactly the same. In my role, variety was a huge deal for me. I'm someone that can get bored easily if I'm doing the same thing over and over again, and it was really important to me to have a role that wasn't just the same thing day in and day out. For some people that works perfect. They want that consistency, but for me, I didn't want that. And being a nurse practitioner, I got the flexibility to do that. I get to see my patients in clinic, I get to first assist in surgery, and I get to do some inpatient rounding. To me, it's the best of all worlds. It keeps me on my toes. I'm constantly learning, and I get to participate in multiple avenues for my patients and the different transitions that they're going through, whether it's in the clinic, into surgery. It's very diverse, and it's diverse in the patients that I see in clinic as well. So that would be number 3, is the flexibility in the role. And then number 4, I would say, is pay. It's not one I want to spend a whole lot of time on, because I would not recommend you go and be a nurse practitioner for the pay I wouldn't recommend you do any job just for pay. Sure, you could do a job for a little while or be in a profession for a little while for pay, but you're gonna be miserable after a while. You really gotta have a lot more underneath that. But as far as if you kind of have some of those other reasons and you are looking forward to this profession, you're gonna get a pretty significant increase in pay, and it doesn't require you to have to work overtime or odd shifts or holidays or weekends or anything like that to be able to get that pay. As a nurse, yes, you can get that, but you have to work pretty darn hard, and you have to have been in the nursing profession for a really long time before you can get that. As a nurse practitioner, you don't have to work yourself to death to get a very quality pay, well-deserved pay for the work that you do. And especially after the pandemic, the need for advanced practice providers is tremendous. So your negotiating power and potential is very high. So the pay is definitely a perk of going back to become a nurse practitioner. Not the only reason, but it's a perk. And then the fifth, I would say, is the many career paths that you have in this profession. I personally, myself, I also run a medical aesthetic practice, and I'd love to talk about that and the business aspect of that and how I'm able to do that as a nurse practitioner. But there are so many paths. You can do consulting, you can do some other type of business venture if that's something, you know, entrepreneurship is something you want. And then there's just lots of paths within this career that you can take. You can go into more leadership roles. You can teach if you want to after some time, just because of your clinical experience and your advanced higher degree that you have, your graduate degree. There's a lot of options and opportunities for advancing your education and getting in this profession as a nurse practitioner. So those would be my top 5 reasons to become a nurse practitioner. And I hope this was helpful if you're looking into this profession and this is, you know, something you're kind of been on the fence about. Maybe you're a nurse, you've been a nurse for a while, and you're kind of trying to debate, you know, what you want to go back to school for. I hope you found this helpful. If you do, please like, comment, and subscribe. If you want to follow me on any other platforms, I'm over at Instagram at the.uterine.nurse. And if you want kind of short snippets because you just don't have the attention span, you can follow me on TikTok at the uterine nurse.